So hello everyone, I'm Dr. Alan Schindel. I'm a urologist who practices in the United States. I'm also a sexual medicine specialist. I'm here speaking on behalf of the Sexual Medicine Society of North America to go over some sexual topics that are interesting to patients but sometimes hard to talk to doctors about or talk about in general. This video is not to be construed as medical advice, nor is it meant to endorse any particular treatment or product. So the topic for today and what I'd like to speak about is sexual enhancement devices, also known colloquially as sex toys. The kind that I really want to talk about in particular are those devices that are inserted, so insertive sex toys, which are those that are designed to be placed into a person's vagina, anus, or urethra, which is the tube through which urine flows. These may include vibrators, dildos, penile replicas, urethral sounds, anal beads, anal plugs, kind of a litany of different devices. The SMSNA itself does not have an official position on these devices. There's relatively scant data from peer-reviewed literature on the safety and efficacy of these devices, but we know that they're very commonly utilized by individuals seeking to enhance or replace sexual function. So the important things to keep in mind, using any sort of device that enhances sexual experience, it is important to buy a device that is really designed for that purpose. Many people will sometimes utilize home devices or devices that are used for other aspects of living for sexual gratification. This can be quite dangerous. I would say most urologists, most colorectal surgeons have stories of people who have lost devices that were really not intended to be used in a sexual capacity, either lost devices in their body or experienced an injury and had to go to the emergency room to have treatment. This is particularly a concern for rectal or urethral devices, and sometimes these can actually progress to the point of needing some sort of surgical intervention. A study of which I was a part actually looked at this very question using what's called the National Electronic Injury Surveillance System, and looking over a 9-year period, 6,800 injuries were identified that had to be treated in emergency rooms in the United States, and that's simply just the ones that went to the ER, not counting ones that maybe were just managed at home. The majority of these, 78% or so, involved injury or loss of a device inside the anus or rectum. And I think this illustrates one of our most important points, that if you are inserting a device or a sexual enhancement product into a body cavity, it should be something that's really designed with that purpose in mind and has a flared base. And this can really keep things from slipping inside inadvertently and then being very difficult to retrieve afterwards. So, speaking of the various orifices on the body, which may be the target of a sexual enhancement device that's inserted, we'll start with, say, vaginal devices such as vibrators, penile replicas, dildos, etc. These are used by many women and other people with vaginas, either for masturbation by themselves or sometimes with partnered intercourse and sexual activity. A study of over 2,000 adult women conducted by the Kinsey Center at the University of Indiana found that about over half of women had used a vibrator or a dildo of some sort, and the majority of these women who had used such a device had actually inserted it into their vagina. These devices, again, obviously very commonly utilized by many, many people, but it's not something you really learn about, how to use this safely and appropriately, and ultimately it's something that, while very gratifying, certainly has some guidance that should be adhered to if you're going to. So first and foremost is cleanliness. These devices, which can be made of glass, silicone, latex, rubber, a number of different substances, wood. These are all things that should be cleaned between uses, and certainly if they're being used by multiple partners, they should be cleaned with soap or appropriate cleaning solutions between usages to prevent cross-contamination, transmission of sexually transmitted infections, etc. Another way to get around this, and some people will actually cover them with a condom. That is another way to, again, keep these devices clean and sanitary, especially if they're being used by multiple partners or multiple people within a given sexual encounter. So vaginal devices, again, used for insertion in the vagina. In a similar way, a lot of these insertive devices may be used for anal gratification, that is to say insertion into the rectum, into the anus, to stimulate the prostate in people who have prostates, but also many women and people who do not have prostates who sometimes do enjoy anal stimulation. An important thing to keep in mind about the rectum and the anus is that unlike the vagina, it is not a lubricating orifice. So again, the anus itself does not naturally produce lubricant, so it is very critical and very important that in context of using a device for anal insertion, that the person or persons using the device use copious lubricant. And again, a water-based lube is oftentimes one of the safest to choose because it is safe for condoms. It is very slippery and can really facilitate sexual activity that is satisfying. Other alternatives include either oil-based or silicone-based lubricants. Some of these can be problematic when used with a condom, and also silicone lubricants sometimes have an unpleasant taste for some individuals. Ultimately, the advice on this is lubricant is essential. The specific kind of lubricant you might use may vary from person to person based on preference and what you're looking for, but there's never such a thing as too much lubricant, especially when involved or when speaking about anal stimulation. An important device for either of these, for both anal or vaginal insertion of devices, is that smaller devices are generally safer in these contexts. And sometimes part of the experience is working up to a larger device or experiencing different sensations with a larger device. It's important to be, again, very careful and judicious and gradual with this process and to be gentle. Unlike a penis or a finger or a tongue or another or part of a person's body that may be inserted into a partner's orifices, a sexual enhancement device or a dildo does not really have that feedback. So it's really difficult to sometimes sense how much force is being applied, what's actually going on internally. And for that reason, like most aspects of sex, communication is really critical. It is very important to look for feedback, to communicate, to listen to a partner, whether one is using the device themselves or using it on a partner especially, really getting that feedback and making sure that the person inserting the device is not using excessive force. It's really, really important. This is obviously important when using a vaginal insertive device. I would say it's even more important when a device is inserted in the anus, because the anus is a part of the body, delicate tissues that are subject to tearing, to fissuring, to cracking. There's no natural lubrication there. So the potential for trauma, and actually potentially very serious trauma to the colon and rectum, can be a really salient and important consideration. So it's very important to get the feedback, important to use lubricants, important to very much go slowly and use small devices that are not going to potentially traumatize a person. As I mentioned earlier, it's important to clean these devices, and certainly if one is engaging in use of a device such as this on a person who has both a vagina and an anus, it is very important that the device that is inserted into the anus is not subsequently inserted into the vagina, because it can cause a pretty bad infection called bacterial vaginosis. And that is something that definitely you want to avoid by, again, thorough cleaning, potentially also use of a condom to provide a barrier against bacteria that are always going to be naturally present in the anus. So we've talked about vaginal insertion, we've talked about anal insertion. There are individuals, mostly male-bodied people with prostates, who actually enjoy urethral sounding, and that is to say, insertion of device into the urethra of the penis, or the urethra in a female-bodied person too. This is not the most commonly performed procedure, but some individuals do find it sexually gratifying, oftentimes due to stimulation of the prostate internally. This practice is again performed by people of all genders and of all sexual orientations. It is slightly more prevalent, however, in men who have sex with men, and about 11% of men in a survey done of about 2,000 self-identified men who have sex with men found that they had at least engaged in this activity once. Contrary to what happens with either vaginal or anal insertion, smaller devices, pointier, thinner devices inserted into the urethra can actually be more dangerous. So counterintuitively, the notion that a smaller device is safer is probably not correct in this context, because the smaller device is going to be much sharper, more pointy, and much more apt to tear the delicate lining of the urethra, potentially leading to injury, which can lead to very serious consequences in terms of bleeding from the urethra, scarring of the urethra that can make urination very difficult. Because sounding is a very dangerous practice, as a urologist, we generally recommend against doing this in a recreational setting because the danger is so high. Having said that, recognize that many people will engage in this activity. It is, as with all other types of insertion, important to consider, number one, cleanliness, washing the device between uses or between uses between partners. Copious lubrication, once again, is always the answer when you're talking about insertion of devices. And as I was saying, going very slow, going very thoroughly, and considering the fact that perhaps larger devices may actually be safer within the bounds of what's feasible, within the bounds of what can actually be accommodated inside the urethra. So a dangerous practice, one we can't really officially condone or recommend, but when done with appropriate amounts of lubricant, appropriate attention to safety, can be done safely under the right kind of supervision and with attention to details. Other risks associated with this include urinary tract infections, sometimes also sexually transmitted infections can be conveyed when engaging in urethral sounding. Hopefully this information was of use and of utility for you. We do have a number of other videos on sexual health topics that SMSNA sponsors. We are an organization dedicated to the fulfillment of sexual wellness and optimization of sexual life, and we hope these videos are helpful for you achieving these goals. Thank you very much for your attention.